I'm Dr. Jason Miller. I'm the Crisis Response Medical Director for the Center for Healthcare Services, and I've been with the center for, on and off for about 8 years.
I'm Dr. Amy Hicks, and I'm the Director for Crisis Response, and I've been with the center almost a year now. I oversee all of the units to include all of the MDRT teams in the Crisis Response Division.
And in conjunction with Dr. Hicks, I do the clinical responses for the MDRT teams. From my perspective, the police in our area have never called me to try to solve a crime. Much the same, we now are in this weird position where we call them all the time to interact with mental health crisis. Part of this is a move in our community to take that ownership back into the mental health units.
So the MDRT teams were developed to take care of the consumer as a whole. So they have not only a mental health officer, but a paramedic and a clinician. So they have a very diversified team, which with all that combined experience are able to address any issues that the consumer may be facing.
Officers by themselves can have an imposing presence. The idea of having a clinician present with them as well as an EMT gives consumers the opportunity to have a more natural interaction. One of the teams that we have specifically looks at the idea that there are certain consumers out there that call 911 on a repeated basis or for whom 911 is called on them. We now interact with them on a very regular basis to try to limit the number of emergency detentions in our community that these individuals undergo. Towards those ends, what we found is that the multidisciplinary response teams have been incredibly useful in this regard. Now, instead of 100% of the time that those individuals interact with law enforcement requiring an emergency detention, with our teams it's limited to usually just 1 out of 5.
I would agree, and literally thousands of community members in Bexar County have already been served by these teams. In fact, many connected to resources that they otherwise would not have had access to. So we're very excited about our teams. So all of the consumers are provided resources during a call. Of course, they have the right as to whether or not they like to accept resources. But overall, one of our teams in particular, our core team, which is centrally located in the city, has had about a 50% efficacy rate.
Yeah, that's significantly improved over most of the rates of response, especially for individuals who are previously getting an emergency detention, where our show rates after an acute hospitalization were sometimes less than 20%. Co-response teams have been a new innovation with mental health response in communities across the nation. They're springing up all across the nation. San Antonio hopes to lead the way in terms of innovative responses to mental health crisis. If you'd like more information, you can contact us at chcsbc.org or bear.org, BEXAR.org.
Or give us a call at 210-261-CHCS or call our crisis line at 210-223-SAFE.